Hello everyone, welcome to my YouTube channel. So this channel is all about making an average student topper. So if you feel that you underperformed in your NEET, UG or PG, and deep inside carry a dream of doing your super specialty MCS from one of the premier institutions in the country like AIIMS, PGI Chandigarh, JIPMAR. So this video is meant for you. This video is going to be a bit longer, so if you are impatient like me, you can watch it on 2x speed. This is a link of our Telegram channel, which is made for INISS Plastic Surgery preparation. You can join this channel where we share other important stuff as well. So before we start, this is a brief introduction about me. These are cool looking loops, which are which we always have as a plastic surgeon because every day we do a lot of microsurgery things and so yeah, I got All India rank 273 in All India PMT. In those days, there was no NEET. It used to be All India PMT, and I did my MBBS from say, GS Medical College and KM Hospital, Mumbai. Then I did my MS General Surgery from TNMC and Nair Hospital, Mumbai. And then I got INISS rank, All India rank 29, and currently I'm pursuing MCH Plastic Surgery from AIIMS Nagpur. So let's start. Watch this video till the end. This I'm going to share the detailed strategy and my experience in this video. So this video should help you. So first and foremost, the very important questions: whether we should do any coaching or we should do the self study. So in my opinion, my answer is no. You do not need a coaching as such. You can do it very well on your own. So first about the exam, who can appear for this INIS exam? Anybody who has done their masters, MS or DNB in general surgery, orthopedics or ENT are eligible for this exam. So to do become a plastic surgeon in India, there are two routes. One is doing through the INI, which is the institutions of national importance, which includes AIIMS, JIPMER, PGI, and through NEET as well. We will talk about this in a separate video, whether we go for the INI and NEET or NEET. I assume that everybody watching this video want to do it in INI, and it's easier, in my opinion, to go through the INI route. So yeah, there are around 500 to 800 people going to participate in this exam, and I feel number of people participating in this exam are increasing by every passing year. There are going to be 25 to 30 seats every 6 months. This exam is conducted twice a year, and this is conducted in the April last week or in the October last week. So, what is the pattern, exam pattern? So, there are two stages of this exam, stage one and stage two. Stage one is going to be our MCQ stage, which will carry 80 marks, 80 MCQ, 1 mark for each MCQ, and stage two is going to be our interview stage, which will carry 20 marks, and your final result will be decided on the basis of marks you secure out of 100. So, to qualify in this exam, in both stages individually, you need to score at least 50%. So, for stage one, you need to secure at least 40 marks to get qualified for the stage two. In my opinion, the important stage is stage one because we do not have much control on stage two because it is conducted as an interview by AIIMS Delhi, so there is not much objectivity, I guess. So, if you want to crack this exam very comfortably, ideally you should score more than 65 so that even if you do not do very well in stage two, it should not hurt you, your final exam. And if you score 55 to 65, still you can make it to the final list. But if you score 40 to 55, then things become like it very much depend upon stage two as well. For example, this time 109 candidates qualified for stage one. So we should aim for more than 55 marks, but at least 40 marks we need to score to qualify for this exam. For that, you need to score, you need to mark correct 50 questions out of 80 because there is one third negative marking as well. So out of 80 questions, 25 to 30 questions are going to be from general surgery. 50 to 55 questions are going to be from the plastic surgery. And so in general surgery, it is divided into two parts. One is systemic general surgery, all the subunits like GIT, urology, CVTS, and other units, and the general part of the general surgery. I think this general part of the general surgery will make you the topper, and because so many people miss this part. Out of 25 to 30 questions in the general surgery, 10 to 15 questions or even more are so general that you cannot actually pinpoint the units from which they are asked. So, what is general part of the general surgery? The book we are going to refer for the general surgery is one and only Our Bailey and Love 28th edition, nothing more than that you need to do. I'll guide you a little bit on how to go with the Bailey and Love. So when I said the general part of the general surgery, I meant till unit 4, the trauma, till here. This is the general part of the general surgery. I have marked the important chapters. You can pause the video and take the screenshot. But few chapters I would like to mention. For example, part 3, perioperative care. This part is very important. AIIMS has this habit of asking questions from this part, like sometimes 5 to 7 questions. This in this chapter, particularly anesthesia. This is very important. Perioperative care again very important. Nutrition. This entire unit is very important. Oncology is very important in AIIMS. Pediatric surgery, general pediatric surgery is very important in AIIMS. And this up till here is, as I told, the general part of the general surgery. Trauma is very important because as plastic surgeons, we are dealing with the trauma reconstruction in day-to-day life. So trauma becomes very important in our preparation. Unit 5 you can skip if you wish. Unit 6 you can skip as well because we are going to read about skin and plastic and reconstructive surgery detail in our plastic surgery part. Head and neck you can skip as well because this is going to be covered in the plastic surgery part. Endocrine and breast, these topics are very important, particularly parathyroid and thyroid, because breast we are very much going to cover in plastic surgery. Cardiothoracic, vascular, particularly aortic disorders, deep vein thrombosis, varicose veins, these chapters are also very important. Lymphatic part we are going to cover in the plastic surgery. So again, GIT of course is very important. In this GIT, the hepatobiliary becomes very, very important. AIIMS for some reason asks a lot of questions from these four chapters, particularly gallbladder. And urology is very important. Transplantation is very favorite of the AIIMS. So this is about general surgery. You do not need to refer anything other than Bailey and Love. And you should not leave any unit from the systemic part except maybe orthopedics because sometime AIMS asks all the questions from one particular unit. For example, sometime they will ask all the 10, 15 questions from the CVTS or sometime from the pediatric surgery or sometime from the onco surgery. So we cannot afford as such to leave behind any unit. So go thorough with the Bailey and Love and focus more upon the general part of the general surgery. So this is about the book you need to refer about general surgery. Now the MCQ part. So in market there are MCQ books available for the previous year questions, PYQs of the INICET, which is held for the post MBBS people. So you should solve these 10-year PYQs of INICET only general surgery questions. So this is very important. And next is Google Images. You make a habit of searching the Google image of any disease or any image you read in your preparation because AIIMS has this habit of asking image based questions. For example, I was asked about the CT scan image of the aspergilloma. So it will become easier for you if you have seen these images on Google. And or you can solve any coaching institutions general surgery grand test around 15 grand test, each test having 200 MCQs should suffice for general surgery part. Do not give much more time in general surgery part. You should focus. You should be giving around 20 to 25% of your preparation time to the general surgery, and rest of the time should be focused upon plastic surgery. So now we will discuss about the plastic surgery. So again, 70 to 80% time will be focused for the plastic surgery. So what kind of questions are asked? First and foremost important thing is contributions in the plastic surgery, because our branch is very much evolving. Lots of things are coming, new surgical principles and guides. So contributions become very important, particularly from Indian plastic surgeons, scientists' names, doctors' names, and images of flaps. As we all know, plastic surgery is very much about flaps. So there are going to be image-based questions on flaps. So we are going to see the images in the chapters as well. The book we are going to read, but you should do Google image as well, because they will give you one image and will ask which flap is performed, what is the name of the flap, what is the blood supply of this flap. So you should be thorough about the images in the flap. Factual questions are asked more than the clinical questions. So the next is which book you should refer in the plastic surgery. So we will refer our one and only book in the plastic surgery for the preparation, that is Grab and Smith, which is 8th edition. In market we have 9th edition as well, but we will study the 8th edition. The reason I will tell you. Mm, so in Grab and Smith plastic surgery, every chapter in each and every page, they will have, let's say, one or two paragraphs only. Rest of the page is almost blank, so you can make your own notes in this. So this will be helpful. Make your own key points and revise accordingly. And every chapter has this key points in the beginning of the chapters, which will help you in the preparation. We give you a thematic idea about the chapter, and every chapter has 5 to 7 MCQs at the end of the chapter. These are very much clinical, very good level MCQs. Sometimes AIIMS directly ask from these MCQs, so you should solve to test your preparation about the chapter. This is very, very important. So now we will discuss about what chapters we are going to read in the Grab and Smith. So there are around 100 chapters. You do not need to get overwhelmed by the Grab and Smith. This book is very much readable and very easy to read. So there are 100 chapters. I have marked them. You can take a screenshot, but few chapters I would like to mention. For example, wound healing chapter is very important. You can skip it from the general surgery book Bailey and Love. You can read it from here. Flap design principle and flap reconstruction principle. These chapters are very important. Skin graft chapter is very important. Transplantation, this chapter is very important. Principle of procedural sedation and local and regional anesthesia. This chapter is the most important chapter, because as a plastic surgeon, we perform lot of procedures under local and regional anesthesia. So we should know a lot about anesthesia. Sometimes AIIMS will ask 3 to 4 questions directly from anesthesia only. So this chapter becomes very important. Standardization of photography, this chapter is also very important. In plastic surgery day-to-day life, we deal a lot of with the photography thing. We take a lot of pictures, before and after pictures, because the reason being, in the field of plastic surgery, we do not have much documentary evidence, radiological evidence about the diseases of the patient. For example, in general surgery, we will have X-ray for the perforation, but in plastic surgery, all we have is before and after pictures. So there are certain principles about the photography. So this chapter is important. I was asked 2 questions in the from this chapter, the photography chapter, and chapter number 18, the statistics part, research and design. This chapter is very important. This chapter is quite detailed here. If you find it difficult to read it from here, you can refer any statistics notes. There are so many notes available in the market. You can refer from there also, but do not skip this part. 2 to 3 questions might be asked. And then this burn unit is very important, and this laser chapter is very important. 2 to 3 questions almost guaranteed. For burn, one more book we need to refer, that is ATLS. That is ATLS, Advanced Trauma Life Support Manual. We do not need to read the entire manual, but we should be focusing upon these 3 chapters: chapter 1, chapter 2, and the thermal injury chapter is very important chapter. And after that, next in Grab and Smith is congenital plastic surgery. All chapters are important, particularly cleft lip and palate, vascular anomalies, craniosynostosis, non-syndromic as well as syndromic, and craniofacial clefts. All types of clefts you should just know the name of, like, which number cleft number 3, cleft number 5, like this. Ear reconstruction, congenital microtia, these kind of things. Head and neck reconstruction. This is the core of oncological reconstruction in plastic surgery. Facial fractures, head and neck cancer, scalp reconstruction, eyelid and ptosis reconstruction, facial paralysis, reconstruction of oral cavity. Very important. And then cosmetic surgery. Not the entire cosmetic surgery, but soft tissue and dermal filler, botulinum toxin, fat grafting, rhinoplasty. Nasal anatomy is very complex and is very important in this exam. And next unit is breast. Breast is very, very important in this exam. Maybe they will ask 7 to 9 questions from breast only. So each and every chapter here, there are number of classifications. You need to study this unit very thoroughly. Very important unit. Body contouring. This is just an extension from the cosmetic surgery unit. Few chapters are important. For example, principles of plastic surgery after massive weight loss, liposuction, and hand surgery. This hand surgery is like quite detailed. There are around 25 to 27 chapters in this grab and smith, and it becomes difficult sometimes at the preparation stage to read it from the grab and smith. So for hand surgery part, you should read this book, Schwartz Principle of Surgery, chapter number 44, Surgery of Hand and Wrist. 80% of the plastic surgery, hand surgery portion will be completed through this one chapter, and the remaining you should refer the GK hand surgery videos. GK hand surgery videos. These videos are on YouTube. There are so many videos, but we are not going to go through all the videos. But few important chapters I would like to mention that we are going to refer in hand surgery. One and like foremost is anatomy of the hand, brachial plexus injuries, flexor and extensor tendon, tendon transfer, ligament of injury hand is very important. Replantation, thumb reconstruction, burned hand, burn reconstruction. You will read about post burn reconstruction in the burn unit, but particularly about the hand burn, post burn contracture in hand is given here. This is very important. Compartment syndrome, they almost always ask one question on the compartment syndrome. Congenital anomaly, hand anomaly, very good videos on the GK hand surgery. And then the trunk and lower extremities, reconstruction of chest and sternum, abdominal wall, lower extremity, particularly leg reconstruction and foot and ankle reconstruction, perineal reconstruction. Then these two chapters are low hanging fruit, I would say. Lymphedema, pressure injuries, very small chapters, almost guaranteed 2 to 3 questions. Gender affirming surgery, again, very small chapter, 1 or 2 questions guaranteed. So this is all about Grab and Smith, how you need to study about the in this book, and this is very readable book. Trust me, you can very well do this. So these are the units of plastic surgery. Number of questions are going to be asked. Briefly, I will tell general plastic surgery. The unit one around 15 to 18 questions maybe. Burns maybe 4 to 5 questions. Congenital plastic surgery 5 to 7 questions. Head and neck 3 to 5. Cosmetic surgery 2 to 3. Breast 7 to 9 questions. Hand surgery 4 to 5 questions. Trunk and lower extremity 8 to 10 questions. So this is going to be your division. So next is MCQ, where we are going to solve the MCQ from. So you have this Agarwal MCQ book, which has around 1000 MCQs. I think you should solve them 2 to 3 times and you will do really good in this exam. There are certain 4 to 5 MCQ books which are very much clinical and very difficulty level a little bit higher. You should go for these books only after you are done with the core plastic surgery preparation, which I mentioned earlier. And chat gpt, what I used to do after reading any topic, I used to take pictures and post it on the chat gpt and ask to chat gpt to make 25 to 30, sometimes 50 questions on particular topic. And I used to give prompt like make very difficult questions, make factual as well as clinical questions, these kind of things. So this should help you, this should make your core preparation. So I prepared for 3 to 4 months for some reason, but you have, let's say, you are preparing for November exam, so you have about 6 months left. So you should prepare for 4 months and complete your syllabus. Give around 2 hours every day for general surgery and remaining 5 to 7 hours for the plastic surgery. And in 4 months you finish all this what I mentioned, and remaining 2 months you revise 6 to 7 times. This is very important. Revision is very important. How to revise 6 to 7 times effectively, that so that it goes into your permanent memory. I have separate video in my channel. You can refer to that video as well. And if you are currently in your second year residency or in the final year and you do not get that much time, so at least try to finish those topics which I emphasized, and at least do the plastic surgery part, because general surgery part you are always already doing. So so who is going to qualify for this exam if everybody is going to follow this strategy? So in my experience, and after clearing 3 exams with the decent ranks, I feel that one who has unbreakable trust in oneself will crack the exam. That no matter what, even if there is one seat, I'm going to get this. Always, maybe you visualize or do the affirmation thing or whatever, but follow this strategy very religiously. Nobody can stop you from cracking this exam. I prepared for 3 to 4 months and I made it. So you will definitely do it no matter where you are studying, which college you are studying. You can definitely crack this exam. Follow this strategy without coaching. You will do this, and don't forget to refer Chat GPT, maybe Google LLM as well for the MCQ part. So this is again a link for our Telegram channel. You can ask about more things which you feel, and we will share books and other things as well. And if you want any other videos made on any other topics, so you can drop a comment. And if you like this video, drop a like. And thank you so much for watching this video. I hope it will help you. Thank you, guys.